right, it's great to have all of you with us today. I want to give a special shout out to the folks who are joining us, especially some of the other elected officials. We have Brenda Wynn, our county court clerk back there. Now, Brenda, were you just up here dancing with me? Because I didn't see you. What? So I'm really happy to be here today to launch our Cities and Communities with Heart Workforce Initiative. This is a great partnership. We started it with the Women's Heart Alliance in February, and it has one goal, to stop women in Nashville from needlessly suffering and dying from cardiovascular disease. That's it. That's the only goal. Because in Nashville, heart disease is the #1 killer of women. In fact, 8 times more Nashville women will die of heart disease and stroke this year than breast cancer. 8. Yet, we don't prioritize this as a public health crisis, even though we know it is. So we're setting a goal to change that conversation. And it's time for all of us to make sure that we're getting our hearts checked, that we're prioritizing our health, and taking meaningful steps to improve our heart health. And we're gonna start that today. So how many of you can hold up a finger like this that has a Band-Aid on it? Because by the end you will, because that means you went and got your cholesterol checked, because we want to make sure that everybody's getting checked, because women wear lots of different hats. You know, we wear hats as mothers, wives, we're daughters, we're sisters, we're employees, we're professionals, we're leaders. Sometimes we're cooks, not in my house, but sometimes. And we're a lot of things. And we take care of everybody. And usually the last person that we are taking care of is ourselves. We don't regularly exercise, we don't go to the doctor, and we don't eat healthy. And we just don't. And then there's that stress out there, all that stress that we feel. And who's got time for that? So before we move forward, we need to make sure that we can support ourselves so we can support our families and we can support our communities. And that starts by making sure we're healthy. Because if we're not healthy, we can't take care of anybody. So I want all of us to start focusing on our health. Oftentimes in the fall, I look at this as the beginning of a new year. This is when I always set my New Year resolutions. Because if we're going back to school, there's this wonderful coolness, usually in the air. And it's a good time to start. You don't have to wait till after the holidays. You don't have to wait till that first part of the year to set that goal, because I have to tell you, health is happening to you every day. You can make a choice today to take a small step, a small change in your lifestyle to make you a little more healthy. And we've got lots of resources here in Nashville to help you. We've got our parks, our greenways, our farmers market, all of the wellness programs that we offer through our departments, a lot of our community-based partners and providers. We just had some great action up here with a little Zumba. We have all kinds of Metro Health benefits and resources that can help you. You don't have to do this by yourself. That's the message here today. There's a whole group of folks out here who want you to be healthy. And I think about y'all, I think about y'all as women, but I also think about you as Metro assets. You're workers, you work for Metro. And if you're healthy, that helps the citizens of Davidson County. Because without you, we can't do anything. Metro can't work or function if we're not healthy. So that's why we're here. That's why we're prioritizing your health. So I want to thank some of our great sponsors today. I want to thank the Nashville Sounds. Thank you, Sounds, for opening this up. I wanted to thank the First Tennessee Foundation. I want to thank Kroger. I want to thank the Little Clinic. And I want to thank all the partners who gave us their time and energy and for the activities, the Metro Public Health Department, Metro Parks and Rec, I see Monique here, Metro Human Resources, the Nashville Farmers Market, Nashville Health, the YMCA of Middle Tennessee, American Heart Association, Nashville General Hospital at Meharry, the Nashville Academy of Nutrition and Dietetics, and the New Beginnings Center. So these partners are also great assets. And I want to thank also British Robinson. I don't know where she is. There she is. Yeah, a minute ago you were behind me. So she is the CEO of the Women's Heart Alliance, and she is our primary partner in all of this work. The Women's Heart Alliance designated Nashville as the first city with heart, and we're so glad they did. So British, I'm going to have you come up and talk for a minute, but I will tell y'all that I went over and I got screened. And I have two things in my family. My mom has diabetes and my dad has high blood pressure. So those are the things that I'm always checking for. So today, my numbers are really good. And it's been because I've tried to make a concerted effort over the last 2 years since I got elected to eat less and walk more. That was it. Eat less and walk more. And it has made a difference, and it's definitely brought my numbers into a better range. So making those two changes has been key. The other thing that we are doing today is getting you certified on CPR. And that may be later here in my notes, but I'm going to talk about it right now. CPR is so important. It will take you 30 seconds to know how to do this. And all you have to know how to do is like sing Staying Alive. Staying, that's it. I'm not going to do the rest. And let me tell you why it's so important, because you never know when somebody that you may be with or you may be in a place with starts to experience some kind of a health thing that would benefit from CPR. And I'm just gonna share with you a personal story. Many of you know that my son passed away about a month and a half ago. Now, the kids who were with him didn't know how to do CPR. I don't think it would have made a difference, but I won't know. You can hear them on the 911 tape as they're trying to talk about how to tell them how to do the CPR. They didn't know how. So if all of you walk away today and learn that one skill, you might be in a position someday to save somebody's life. And I think that's a really great gift. So now I am gonna bring British up here. British, come on up.
Thanks, Mayor Berry.
You bet.
It's a privilege to be here, and I think you highlighted so well what community is all about. And Nashville is about community. It truly is a community with heart, and we are honored and humbled to be your partner.
Thank you.
And to stand alongside you as you make Nashville a healthier community. It is my distinct honor, Mayor, to thank you for all of your hard work and to your staff for all that they've done.
They're great,
And in particular, we want to thank the Gender Equity Council for working with us to launch the Women's Heart Alliance Cities and Communities with Heart Workforce Initiative here today. I also want to thank First Tennessee Foundation, the Women's Heart Alliance national partners, Mars Symbiosciences, Bristol-Myers Squibb, Pfizer, Boston Scientific, and all the fabulous community partners that the mayor already listed. We couldn't do what we do without your support with us. I also like to thank our medical advisor, Dr. Holly Anderson, who is here today, and she is here with her hands-only CPR campaign. We're thrilled that she is able to add her technical assistance and ongoing activity to our work, so be looking for that. All done in concert also with the American Heart Association, so we thank our friends that are here from the AHA as well. And on behalf of our board and our staff, we're proud to sponsor the Workforce Initiative for you, for the female Metro employees who make Music City the most vibrant and exciting city that everyone wants to move to or visit. We certainly love it. Woo! The mayor told you about the statistics in Davidson County, but let me tell you, this is a national crisis. Most people are stunned to learn that in the U.S., cardiovascular disease is the #1 killer of women, claiming more lives than all cancers combined. Claiming 1 in 3 women die of heart disease nationally, and 1 woman dies nearly every 80 seconds. Heart disease is preventable, just as the mayor said. You walk, you watch your diet, we can do this. Prevention is cure. Why is this happening? Why is it still the #1 killer? It reflects a gap in awareness, in prevention, in diagnosis, treatment, and support. Because women aren't encouraged to share their stories of heart disease. And without that personal connection, we can't create a movement. Nashville, we need you to help us create this movement. Next, you'll hear some powerful stories from 2 survivors from Nashville who overcame the odds and are going to share their stories with you. Learn from them about their unique symptoms, women's unique symptoms of heart attack. Be empowered to go to the emergency room when you know something isn't right. And finally, share what you learned today with all the women you know. Nashville knows the benefits of partnership and that working together can bring about change. Everyone has their part to play in improving women's heart health. Employers can sponsor heart screenings and wellness activities like what we're doing here today. The faith and community-based organizations can help with outreach programs, and local officials, can't think of a better one than your own Mayor Barry, who's working on promoting heart-healthy development in your community. In other words, advancing heart health is a team effort. So let's work together to build a movement here in Nashville around women's heart disease. Let's work so that I urge each and every one of you to go back to your offices and be an ambassador for women's heart health. You can make real change in a person's life while helping them get heart checked. Our founder, Barbara Streisand, likes to say, if we focus people's minds on the battle of women's hearts, we can save lives. And that's not a bad day's work. Thank you, and thank all of you for getting heart checked today. And with that, it's my privilege to introduce you to a nurse who learned about women's unique heart symptoms through another Cities and Communities with Heart initiative through her employer, St. Thomas Health. That knowledge saved her life. Please welcome Renee Bottoms. Renee?
Yeah.
Thank you.
Thank you, British, and I'd like to thank Mayor Barry and Wendy Carter for inviting me to tell my story. I am an RN at St. Thomas Midtown Hospital, and last May I was at work and attended a Caring for the Caregiver health fair that they had started. And one of the areas discussed was the different symptoms of heart attack between women versus men. Well, later that night, I woke up with my arm feeling very numb and a sharp pain between my shoulder blades, and I was just brushing it off, thinking it was just part of my asthma problems that I'd been having. But I knew the numbness to my arm was not normal, and I knew that the sharp pains between my shoulder blades was getting worse, and that was not normal. So I decided to go on into the ER, and sure enough, I was admitted with a heart attack. Later on, as I was going through everything that had been happening up to that time, I realized how tired and fatigued I was. And every time I sat down, I would just fall asleep. I had no energy. That should have been my first sign that something was going on and should have been checked out. I would like to stress to the women here today and the women as a whole population that you know the normal for your body, and you need to listen to the signs when that normal is into the ER. It will pay off, and it may help save your life. Thank you for inviting me to attend this kickoff and help to get Nashville healthy. Thank you.
Thanks, Renee. So Renee, thank you for sharing your story, and she's exactly right. Women have totally different symptoms than men. Pay attention to what your body is doing. Pay attention. And if you don't feel right, don't wait. Go to the emergency room and get it checked. Now we're gonna hear from Janice Phillips, who works with the Metro Action Commission. She has a great story to tell when she was listening to her body and literally listening to her heart and the amazing difference that it made for her. So come on up, Janice.
Thank you, Mayor Barry. Thank you, my agency, for inviting me to speak. February 8th, 2011, 11:30 at night, I'm reading a book, I'm laying in bed, I'm having a good time with my book. And I start feeling bad. And at first I think it's the way I'm laying, so I straighten out. I'm finished reading my book. I'm still not feeling well. So then I think, I might be having a heart attack. It just happened to come to my mind. And then I thought about 5 cousins, all of my grandparents. My cousins died before the age of 55. My grandparents died before the age of 65. And I thought, I love you all, but I'm not joining you tonight. But then I got silly. I thought, okay, if they say you're having a heart attack, you should chew an aspirin. You should unlock the door, sit by it, wait on the ambulance, call 911. I get dressed, and then I realize I don't have aspirin. I need to go get aspirin. So I get my keys and I go out to get aspirin. On the way to the store, I passed the fire hall. They're asleep. It's 1:30 in the morning. I keep going. I see the store, I keep going. I pass a hospital, I keep going. I jump on the interstate to get to the hospital of choice. But I walk in the door at 1:30 a.m. and I tell the guy I'm either having a panic attack or I'm having a heart attack, but I think a heart attack. He walks me back to the exam room. They do all the things that they're supposed to do. They start doing blood work. They hook me up with IVs. They're doing x-rays. They give me nitroglycerin. For 30 minutes, I feel really good. And then it starts again. Another nitroglycerin tablet. 30 minutes later, I'm not feeling well at all. Now I got the nitroglycerin patch on my leg. Still no good, and they're bringing out the morphine and calling in reinforcements, my PCP. 9 o'clock that morning, a cardiologist comes in. She orders more blood work, and she says that I had a heart attack. I had what is known as a non-Q wave heart attack. That means that when I'm in the ER and all the machines are hooked up, it's not registering. It's typical of women. It's typical of women under 50. It's typical for women under 50 who have non-Q wave heart attacks to die because everybody says you're fine, and you go home, it's indigestion. It's a lot of things. It's a heart attack. They do the catheter to see if I have blockage. There's none. So now the question is out there, why did this woman have a heart attack? Fast forward to a year and a half later. I go to the cardiologist and they do an echocardiogram. This is the third one. And the technician finds a hole in my heart. I have an ASD. I don't know what that is, so I have to look it up. It's an atrial septal defect. Ostium primum. They threw in some more letters on me. ASD is a defect with the heart's 2 upper chambers. And the wall that separates the left and right sides has a hole that doesn't close at birth. But then she says, we're going to set you up for an MRI, and we're going to see how many holes you have. And then she goes on about how she's got to go with the insurance and all that stuff. And I'm thinking to myself, holes? She said S, holes. How many holes can a person walk around with in their heart and still live? Well, the answer is 3. I had an ASD, a VSD, which is a ventricle septal defect, a cleft mitral valve, and a leaky tricuspid valve. My dad worked in medical research, and I read off the little note to him, and he looked at me and he said, little girl, you got a problem. That was May of 2013. July of 2013, I had open heart surgery. I can tell you a lot about that, but I researched. I wanted to know what was going to happen to me when they cut open my chest and how it was going to happen. I asked the doctor, the surgeon, what happens if the power goes off? I wanted details. I wanted to know he had a backup plan because I knew I was going to get one. Well, the power didn't go off. I survived it. I was, as my mom says, a textbook patient. I did everything the way it was supposed to be done. I had no complications outside of the anesthesia making me too sick. But I like to tell the story because a lot of women my age group are born with holes in their hearts and they don't know it. So when you're starting to feel bad and you think it's indigestion, please get it checked out. It's not just indigestion. It could be something more. And if you go to the emergency room and they say you're fine, ask them, did they do the enzyme test, all 3? Because that's how you find out about this kind of heart attack. Thank you for listening to me.
Wow. So Janice, we are so glad that you were here with us today. And I have to tell you, I've been inspired, I've been motivated, and I hope you all have too. Because when people share their personal stories and they tell you what really happens, hopefully that tells you what could really happen to you too. And I think that we know that it is just really about eating better and walking more. And if we can do those things, we'll be more heart healthy, we'll be strong, we'll be around to care for the people that we love for a really, really long time.